Welcome. Today, we will learn about Eno. Eno fruit salt lemon flavor is an antacid powder. It provides fast relief from heartburn, indigestion, and upset stomach. It provides fast relief of the symptoms of acidity once they occur. It is for oral administration only. Children under 12 years shouldn't use it. Package contains. Each package contains 12 sachets in lemon flavor. You can also buy in a bottle and a 72 sachet box. It is also available in other flavors like orange and fruit. Salt. Composition. Each sachet has 5 gm net. Each 5 gm sachet of Eno powder contains sodium bicarbonate BP 2.32 gm, anhydrous sodium carbonate 0.5 gm, citric acid BP 2.18 gm, sodium carbonate, decahydrate, lime flavor, lemon flavor, saccharin sodium, speck-free green. Indications, uses. It is indicated for the symptomatic relief of heartburn, acid indigestion, sour stomach and upset stomach due to these symptoms. Heartburn is a burning sensation in the chest caused by the backflow of stomach acid into the esophagus, often triggered by spicy foods, overeating, or lying down after meals. Acid indigestion refers to discomfort or pain in the upper abdomen due to excessive stomach acid. A sour stomach involves a queasy or acidic feeling, often accompanied by a sour taste in the mouth or mild nausea. Upset stomach is a general term for symptoms like bloating, gas, and discomfort, usually resulting from indigestion or mild dietary disturbances. Eno works by neutralizing excess stomach acid and producing a gentle effervescent reaction that helps relieve these symptoms quickly, restoring comfort and digestive balance. Directions for use. 4. Oral administration. For adults and children aged 12 years and over. Dissolve 5 gm or 1 sachet in a minimum of 1 cup of water. Drink as symptoms occur. Wait 2 to 3 hours before taking a second dose. It is recommended that a person should consume Eno powder as soon as it has completely dissolved in the water, while the bubbles are still there. Instructions. Do not take the second dose less than 2 hours after the first dose. Do not consume more than 2 times a day. Do not take for more than 14 days. In the event of overdose, seek medical advice immediately. Do not use for children under 12 years of age. Keep out of sight and reach of children. Store below 30 degrees Celsius in a dry place. Read the instructions carefully before use. Do not use Eno powder if it is past its expiration date. Cautions. Should use it with caution if you have high blood pressure, heart failure, kidney disease, liver disease, low calcium or potassium levels, on a low sodium diet. Pregnancy and lactation. Eno, an antacid containing sodium bicarbonate, is generally not recommended during pregnancy without consulting a healthcare provider. Excessive sodium bicarbonate intake can potentially disrupt the delicate electrolyte balance in the body. Lactating women should also consult their medical practitioners before use. Side effects. Eno powder is generally considered safe for occasional use. Some side effects may occur, especially if it's taken too frequently, in large doses, or by people with certain medical conditions. That is why it is not advisable to take it continuously for more than 14 days. It can sometimes cause stomach gas and gut irritation, bloating. In some cases, the change in pH and fluid balance in the stomach may lead to mild stomach cramping or mild diarrhea. Eno contains sodium bicarbonate, which can increase sodium levels in the blood if taken in excess that may lead to fluid retention. Some individuals may experience allergic reactions, rare, like a skin rash. ENO can cause metabolic alkalosis, very rare. Its overuse can lead to a disturbance in the body's acid-base balance, causing nausea, vomiting, and headache. Manufacturer and buy online. ENO is manufactured by GSK Consumer Healthcare Pakistan Limited. For more information on products or any adverse reporting and information, visit the GSK website at their link. It is available online or you can buy it from any nearby pharmacy. It is available at the retail price of around 210 rupees. You can buy a single sachet at the retail price around 15 rupees. Thanks for watching and supporting. Take your medicines as your doctor or pharmacist prescribes them. You can check its article at MedsArchive.com. Have you ever used this medication? Please share your experience in the comments. Which medicine should we cover next? Your suggestion could be our next video. MedsArchive 1.